All right, here we go. Hello, everyone, and thank you for watching this webinar on CPT and ICD-10 code pairing. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, or forwarding of this target coding presentation is illegal. The information in this webinar is for educational purposes. It's not intended to be legal advice. I've made every attempt to make certain the information is 100% accurate. However, it's not guaranteed. Let me tell you a little bit about myself before we get started. My name is Dr. Marty Kotler. I'm a chiropractor. I practiced for many years, and then about 12 years ago, I started a company called Target Coding. After I started the company, I realized I have to get informed on the best way to help my clients get paid better and do things properly. So I went for certifications. I became a certified billing and coding specialist. I became a certified professional compliance officer. So I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So you'll see how I combine the two to help bring the information to the doctors to help them be better doctors, be better clinicians, and bill and code better, and make sure you're not leaving any money on the table. A lot of people say, oh, Marty, you're the insurance guy. I don't consider myself the insurance guy. To me, it doesn't matter if you're an all insurance practice or an all cash practice. What we do here at Target Coding is make sure you're complying with all the laws, rules, and regulations in your state, and you're also maximizing reimbursement. We want to make sure you're maximizing reimbursement and you're not leaving any money on the table. What else have I done? I've written a book on billing and coding. I also have 10 training videos that I've created for chiropractors, physical therapists, acupuncturists, and massage therapists. I write articles to some of the major magazines in our profession, like Chiropractic Economics, Dynamic Chiropractic, The American Chiropractor. I also write articles for many state association newsletters, and I'm a guest speaker at many conventions nationwide. So that's a little bit about myself. Now, let's get started with CPT and diagnosis code pairing. Don't ever choose a diagnosis just because it seems right or it feels right. I remember being in practice many years ago, and a patient would come in and say, Doc, my back hurts and I have pain down my leg. I automatically diagnosed the patient with sciatica. I didn't do anything to substantiate it. I didn't do anything to, prove that it really exists. I didn't do any orthopedic neurological tests. I just, it's sciatica. That's not okay, especially nowadays. In order for your services to be considered reasonable, justifiable, health plans, state scope of practice laws, standard practice acts require your diagnosis codes to have validity, and they are compatible with your procedure codes. The rationale for choosing a diagnosis must be part of your game plan. And I like to talk about the what and the why. Understand the what and the why. Your CPT codes are what you're doing. That's your procedure. CPT stands for current procedural terminology. So your CPT codes are what you're doing, like an exam, x-rays, chiropractic adjustments. And your diagnosis codes are why you're doing them. Subluxation, radiculopathy, sciatica, muscle spasm. Make sure that they pair. Make sure that they combine. I don't know how many of you have ever been to a food and wine festival. There are sommeliers, there are experts there that teach you how to combine your food with your wine to have this maximized culinary experience. So that's what I'm going to be sharing with you today, how to combine your codes, your CPT codes, and your diagnosis codes. Why? So you could ensure proper reimbursement, and you can look good. If you're ever in a malpractice case, you can justify everything you're doing. If there's a state board complaint against you, your scope of practice in your state requires you to do these standard combining. So let's go through a couple of them right now. It comes with, the clinical rationale, and the documentation suggestions are part of this. So let's start off with a few CPT codes. So hot and cold. This is pretty simple, right? What is the clinical rationale? What's the reason for doing cold packs? It's for vasoconstriction, reduce inflammation. Hot packs, it's used to relax the tissues, reduce spasm. That's an easy one. Mechanical traction. 97012 is a very common code used in chiropractic. I, I think it's the most common modality used in the chiropractic profession, mechanical traction 97012. So let's say you're using that code. And let's say, Mrs. Jones came in and you did it on her, I don't know, 17 visits in a row, and now you're questioned by an insurance company or, state board. Somebody's questioning you. Peer review. So, Dr. Kotler, why do you do traction? Why are you doing traction? We see you're doing traction on this patient. You've done it 17 times. Why do you do it? When are you going to stop doing it? Is it something that has to be done on every visit? So, why are you doing traction? Have a good answer. There's the answer right there. We use traction to separate and stretch the spinal segments. We use it to promote distraction and gliding of the joint facets. We use it to promote hydration. So, those are the sensible, logical answers that you should be using. Next, any of you use electrical stim, whether it's unattended or attended? So the CPT codes are what you're doing. Unattended stim has two codes. I know that's confusing, right? 97014 is the CPT code for unattended stim, and G0283 is the HCPCS code for unattended stim. And then we have attended electrical stim, which is 97032. So we're not going to get into too much of the billing aspect here of codes. We're trying to, again, show you here how to combine your codes, how to pair them. It's like a buddy system. You want to always buddy up your CPT codes and your diagnosis codes. It'll help you SWAN. You ever hear that acronym, SWAN? It's my favorite acronym. It stands for sleep well at night. So if you buddy up your codes, you'll be able to SWAN better. So here, if you're questioned, why do you do electrical stim? Well, we use it to reduce spasm. Low volt stim, reduce edema. High volt, there's different mechanisms. I'm sure some of you use Russian stim and all different types of TENS devices. Make sure you know why they're being used. You don't want to get caught with your hand in the cookie jar. Helps to reduce swelling, helps the reduction of post-traumatic inflammation, promotes wound healing. Let's look at another one, 97110, also a very common code used by chiropractors. This is, I think, my favorite rehab code, Therapeutic Exercises. So if a patient comes in, if you're billing 97110, that's what you're doing, right? Therapeutic Exercises. Now, why are you doing it? Remember, that's the diagnosis code. The procedure code. Well, the procedure code says therapeutic exercises should be used to develop strength, endurance, range of motion, flexibility. So if you're billing 97110, let's say in your mind, you're thinking it's to increase range of motion. So what should the patient have a lack of when they come in if you're billing 97110? Yeah, you got it. They should have a lack of range of motion. Take a look at your exam. Does your exam show reduced range of motion? I've seen some chiropractors, again, get caught with their hand in the cookie jar, whereby they're billing 97110, and then they have to give money back. Why? Because the examination and the treatment notes say normal range of motion, normal strength, normal flexibility. So that's where the insurance company could say, well, if everything's normal, why are you billing 97110? You have to show that there's a problem. And by the way, 97110 is an active procedure. The patient has to be doing the work. If the patient is just lying on the table and you're just stretching them, that is not an active procedure, therefore not 97110. Here's another good one, 97112, Neuromuscular Reeducation. It's typically used to improve balance or coordination, kinesthetic sense, proprioception. So that's what you're doing. You're doing neuromuscular reeducation. So why would you do it? Diagnosis code, maybe vertigo, or maybe there's some sort of sprained ankle, and you're using neuromuscular reeducation to improve the proprioception from the ankle up to the brain, right? There's all these different things as to why you're doing them. Now we got to get into how to match them with the diagnosis codes, but it starts with your documentation. Here, let's talk about diagnosis code and documentation. Here's a pretty common diagnosis code. This is why you're doing it, right? So if you're going to do, let's say, a chiropractic adjustment on the sacroiliac joint, that's what you're doing, a chiropractic adjustment, 98940. Why are you doing it? Because the patient has a SI joint subluxation or sacroiliac sprain. So here we go, sacroiliac sprain, S33.6. So if your question, hey, Dr. Kotler, why, how did you come up with, this is a common question. Some of you that deal with managed care organizations, so you submit your medical necessity review information, right? There's some major organizations now that are um, working with Blue Cross Blue Shield, Aetna, Cigna. You know what I'm talking about, like United Healthcare. They have a relationship with Optum. Optum has case managers, reviewers that look at your paperwork and they pre-authorize care. So let's say you sent in a diagnosis of sacroiliac sprain, and now you're talking to the case manager or the clinical evaluator, and they go, "Hey, doc, how'd you come up with that? I'm looking at your exam. I don't see. How did you, well, I'm not approving care, right?" You might hear that. So if you're using S33.6 as a diagnosis, then your notes should say something like, yeah, there was pain in that SI joint. Orthopedic tests were positive with Yeoman's or Ganslin's. There you go, guys. There are the two gold standard tests, orthopedic tests for any type of SI joint problem. So if you're diagnosing any type of SI joint problem, and your exam doesn't have Yeoman's, Ganslin's, for Patrick, none of those, then you could made to look unprofessional. How did you come up with that? You want to have, create that little breadcrumb trail leading up to the diagnosis. And it's not difficult. How many diagnosis codes do you use? Maybe 20, 25, in ICD-10, there are 70,000 diagnosis codes, but typical chiropractic, what do you use? About 20, 25. And that's what I'm showing you here, a whole bunch of the most common ones. So get these, down pat, figure out a system in your software, how to, make sure if you're going to do a sacroiliac diagnosis that your exam populates Yeoman's, Ganslin's. There's no, neurological. I don't think there's any neurological test that you can do to justify a sacroiliac sprain. Now, again, I have my clinical hat on right now. I'm sharing you clinical information. A lot of you go, "Hey, Marty, you're the coding expert. You're the code geek." Yes, but I'm just, going outside of my lane a little bit here, sharing you with clinical experience, 16 years in practice. So, I plus this is stuff that some of my clients have assisted me with that are, rehab specialists. And chiropractic findings, tenderness, edema, subluxation, hypertonicity, M54.12, cervical radiculopathy, very common chiropractic diagnosis. So if you submit this to an insurance company, your notes better show patient presented today with neck pain and pain down the arm, orthopedic tests, Jackson compression, foraminal compression, you don't have to do all of them. And if you forgot how to do shoulder abduction, nowadays just go to YouTube, type in shoulder abduction. You'll get a little 30-second video reminding you how to do it. Add it to your exam form. Neurological tests with cervical radiculopathy, yeah. Check reflexes. Is there any myotomal weakness, dermatome changes? Of course, there are chiropractic findings, limited motion, tenderness, subluxations, hypermobility or hypomobility. Maybe you want to refer the patient for an MRI or x-rays, but you don't need an MRI for radiculopathy, in my opinion. Again, I'm giving you some clinical stuff for a herniated disc or a bulge disc or, disc displacement, disc disorder. Yeah, MRI, CT. I wouldn't diagnose those without imaging. And yeah, here's some more radiculopathy codes. Sciatica is a type of radiculopathy code. Now, never use M54.3 or M5430. Those are not codes that are provided to the highest degree of specificity. In ICD-10, the highest degree of specificity is important. By the way, every year, October 1st, the new ICD-10 codes come out. Just to let you know, there's no major changes this year for ICD-10. So whatever book that you bought for 2019, it's okay for 2020, especially if you bought Target Coding's book. If you just bought it last week, don't get scared. Don't get nervous if you hear, "Oh, there's new codes." There's basically nothing that has changed as it relates to chiropractic. There were hundreds of updates, but they were for dermatologists and surgeons and other doctors. But for chiropractic, pretty much nothing. So don't worry about that. Now, there are combo codes, low back pain with sciatica, M54.4. Never use that. Never use M5440, unspecified. get specific, code to the highest degree of specificity, right and left side. So, oh yeah, so this is, I mentioned my book. This is a excerpt out of the book. I put together about 25 of the most common chiropractic diagnosis codes, and I supply you with the subjective findings that your notes should have, your ortho, neuro, chiro tests, some imaging recommendations. It's just one section of the book. There are 3 sections of the book. This is section 2 of the book. So now, here we go. Now I'm going to give you specific examples of code pairing. I mean, think of, like I mentioned earlier, a wine and food festival. You want to buddy up, you want to combine your food with your wine, your red meat with the red wine, the white meat, I'm sorry, the fish with your white wine, right? You may have heard that. So here comes a patient. What are you doing? Mechanical traction 97012. Why are you doing it? Because the patient has M54.12, cervical radiculopathy. What does that mean? Your orthopedic tests, your neurological tests are there. So you have that breadcrumb trail. Remember the breadcrumb trail. Here comes Mrs. Jones. She says that she has neck pain and pain down her arm. There's your first breadcrumb, the subjective findings. Your second breadcrumb is your exam, foraminal compression, restricted motion, pain, discomfort with foraminal compression. There's your exam. And then what are you going to do? Well, we know what's wrong with the patient. What are we going to do? We're going to do traction to separate the joints to help promote distraction. So there's one example. Here's another one. Patient comes in with neck pain, shoulder stiffness, quadricep strain. That's what's wrong with the patient. What are you going to do to help? Well, therapeutic exercises pairs beautifully with shoulder stiffness and quadricep strain. It's a natural treatment. Somebody has stiffness in a joint, and now you're going to do exercises to increase range of motion because the patient has reduced range of motion. There's a beautiful pairing right there. A few codes. Oh yeah, I mentioned sommelier earlier, the wine pairing, expert, master in food and wine. I consider myself a coding sommelier. I'll show you how to pair your CPT codes and your diagnosis codes so you could maximize your reimbursement. All right, let's say you do a lot of soft tissue. You use a lot of manual therapy, 97140. Part of manual therapy is it's a combination of one or more of the following: myofascial release, joint mobilization, soft tissue mobilization, manual traction, manual lymphatic drainage. That's all part of 97140. And let's say you are a practice that does a lot of deep soft tissue work, like myofascial release, right? That's a very common technique in chiropractic, myofascial release. Okay, you love doing it. Well, here comes Mr. Thompson. Guess what? He's got myofascial pain in his cervical region. That's M7912. You see how that pairs beautifully? Myofascial pain, M7912, with myofascial release, 97140. So that's a really good one to, show you the connection. Also, herniated disc bursitis of the right hip, M70.71. Pairs beautifully with manual therapy. Purpose of manual therapy, I didn't show you the clinical rationale for manual therapy because we have limited time. I showed you traction, I showed you therapeutic exercises, I showed you neuromuscular. There's a bunch of other codes like manual therapy. So what's the clinical rationale for manual therapy? There's many clinical rationales for manual therapy, but one of the clinical rationales is to reduce edematous or edema in the joints. Bursitis is edema in a joint. So that pairs really nicely. Now, what about chiropractic adjustments? If you were questioned, let's say you were on the witness stand, said, Dr. Kotler, we see you're doing chiropractic adjustments on a patient. Why do you do chiropractic adjustments? How did you come up? What's the clinical rationale for a chiropractic adjustment? Does anyone know? If you were, questioned by an insurance company or a state board, Dr. Kotler, we see that you diagnosed a patient with subluxation and you're doing chiropractic adjustments. Can you explain how did you come up with the diagnosis of subluxation? Now, that's a real open-ended question, right? You know, you could have many different answers. How did you come up with a diagnosis of subluxation? You know, that could depend on what chiropractic college you graduated from. What is your belief? What is your, what is your technique? You know, what do you do to prove that a subluxation exists? Okay, so I'll give you my answer. I'll base it on a very popular approach. That's the PART exam, PART, palpatory tenderness, misalignments, restricted range of motion, and tissue and tone changes. So now that you came up with the diagnosis of subluxation here, there's the M99 codes for subluxation. There's also the traumatic or injury related subluxation codes. See them on your screen. And how do those pair? Those pair beautifully with chiropractic adjustments, chiropractic manipulative treatment. So how do you define a chiropractic adjustment? What's the purpose of a chiropractic adjustment? It's to what? Correct a subluxation, improve neurophysiological function. That's a term right out of the AMA CPT code book. So we just share a little bit about, I mentioned a couple of these timed codes. So I just want to make sure everybody knows the deal with time-based codes. 1 unit is 8 to 22 minutes. That's what you should be putting in your notes, exactly the time, 10 minutes, 12 minutes. Don't put 1 unit. Don't put 8 to 15. Don't put a range. Put exact amount of time that you spend. And if your question, so Dr. Kotler, we see that you did 10 minutes of therapeutic exercises. How did you know it was 10 minutes? What would you say? If your notes say chiropractic adjustment, here, I'm going to give you a little surprise quiz here. 10 minutes of myofascial release, 10 minutes of therapeutic exercises, 5 minutes of mechanical traction, and you do a chiropractic adjustment to C5 and C6. How would you bill this? But before I get to the second question, the first question is, Dr. Kotler, we see that you did 10 minutes of myofascial release and 10 minutes of exercise. How do you know it was 10 minutes of each? How would you answer that? You think it's a pretty easy question to answer, but many doctors that I work with, especially the doctors that are being audited or they're undergoing a deposition in a PI case or an injury, I ask the doctor, what happens if the defense attorney asks you, how do you know it was 10 minutes? What are you going to say? Most of the doctors do not know how to answer this question. So a good answer would be, well, I wear a watch, or we have a clock in every room, or we have a timer on the table. But this is how this one would be billed. You would bill 140 or 110 with the traction and the adjustment. How about this one? 15 minutes of myofascial release, 10 minutes of exercises, and you adjust C2, T10, and the left SI joint. There you go. We got to 23 minutes. We have 25 minutes, so that's how that one would get billed. There's another one, 15 minutes of massage, 10 minutes of ultrasound, and then 13 minutes of neuromuscular reeducation. And we adjust L4, L5. Ooh, this is a big one. Here we go. Massage, ultrasound, NMR, and then your adjustment. I have one more of these. All right, re-exam, 10 minutes of ADL instruction, 15 minutes of massage, and you adjust C1 and L3. How would you bill this? Re-exam, ADL, massage, and your adjustment. Now I want to show you an actual claim form on how you can pair your codes. Let's get back to pairing. Look at the procedure 98940. The diagnosis pointer in 24E is A and B. What is A and B pointing to? A and B is pointing to that sciatica and muscle spasm in the lower back. So I'm adjusting the lower back. There's my combining right there. What am I doing? Chiropractic adjustment. Why? Look at A and B. Now, I'm also doing manual therapy with the 5-9 modifier. That's what I'm doing, manual therapy. Why am I doing it? Because the patient has cervical radiculopathy and myofascial pain in the neck. Perfect combining right there. And then what else am I doing? Unattended stim? Well, where am I doing that? Why am I doing that? Oh, the patient has thoracic disc degeneration and thoracic pain. And then I'm doing, therapeutic exercises. Why? I know what I'm doing. I'm doing therapeutic exercises to improve strength or range of motion that requires application of clinical skill. If you're ever questioned, Dr. Kotler, why do you do therapeutic exercises? Or what clinical skills do you apply while you're overseeing a patient doing therapeutic exercises? How would you answer that? How would your staff answer that? A lot of CAs oversee the exercises, so make sure you know what clinical skills you're applying. If you're not applying clinical skills, the insurance company can say, sorry, we're not paying. Here's a Medicare example. Again, with the code pairing, we did it a chiropractic exam 99203. That's what we did. That's the CPT code. What did we do? An exam. Why? Because the patient has lumbar subluxation, lumbar radiculopathy, cervical subluxation, and cervical disc degeneration at C5, C6. You see how that pairs beautifully? And there's the adjustment with the AT modifier. And here we have a PI example. So we have cash, insurance, Medicare, PI. So we're doing a chiropractic adjustment to A, B, C, and D. Then there's the therapeutic activities just to A, B, and C. And then we have the massage to E and F. That's the shoulder. All right, so just a few closing comments. I'd like to close today's presentation by telling you about my 9-step action plan. Step 1, get proactive. Don't wait for the oil light to flash on your dashboard. Get out of the car, open up the hood, check the oil. Very important nowadays. Be proactive. Every doctor that I work with that has been audited and has had the stress of dealing with an investigation, they always say, oh, Dr. Kotler, I wish I hired you 2 years ago, or I wish I would have gone out to do more seminars. And by the way, you should go to at least 1 seminar a year. Step 2, this is for staff members, CAs listening to this. Make sure when a new patient comes in, get all those forms signed. Every single form that you give the patient needs to be completely filled out and signed by the patient. Don't mess around with that. It's another thing that I've seen become an issue, especially, I don't know how many of you prescribe TENS machines or back braces. The patient has to have chronic pain. If the form doesn't say how long the patient has had the problem and you don't address it, it's another issue that can come up. Step 3, doctors, review the paperwork before you walk in to do the consultation, especially the review of systems. A lot of what I teach lately is not only billing and coding and compliance with Medicare and HIPAA, but I also teach medical errors, risk management, malpractice prevention. So, take a look at that review of systems form. See what the patient checked. If the patient checks something unusual and you don't look at it and you don't address it, you could have problems down the road. Review the paperwork. Step 4, review the policies from the insurance companies that you bill the most. I call it the 35% rule. If you're collecting more than 35% of your income from one insurance company, do a deep dive. Get the policy. Make sure all the doctors are aware of the policies on that particular, from that company. It could save you a lot of stress. We went over step 5, the what and the why. Step 6, do a self-test on your SOAP notes. If you don't know how to do that, hire someone to help you learn how to take out one of your SOAP notes and see if it can pass an audit. Find out what a medically necessary SOAP note looks like and duplicate it. Step 7, keep learning. Like I mentioned earlier, attend at least 1 seminar a year on billing and coding. Go to your state association convention, at least 1 a year. Get updates. Don't stay in your office in a little bubble. Step 8, put together a simple billing compliance manual. That's another thing. You're going to be seeing a lot of advertisements coming up now because it's an important issue. A lot of the major companies now are going to be promoting, you'll see in chiroeconomics, dynamic chiropractic, chiropractic compliance, compliance, compliance. Now, in our opinion, compliance is about the big 3, HIPAA, OIG, and OSHA. So get together with your staff and start working on a HIPAA, OIG, and OSHA compliance manual. If that's too much of a headache, if it's too much of a hassle, then find somebody that could do it for you. Guess what? We do that. If you're interested, let us know. And step 9, conduct regular staff meetings, specifically with staff members that do your billing, especially to the insurance companies that pay you the most money. Also, do you use a billing company? By the way, Target Coding now does billing. We now offer billing services. We've been getting that question for the last 5 years. Do you do billing? Finally, we could say yes. Those of you that want to outsource your billing to Target Coding, we now offer billing service. Now, if you use a billing company, do a spot check. I'm working with 2 doctors right now. They're being audited. They're on a prepayment audit because the insurance company said, we see your pattern of billing certain modifiers is way above all your other, all the other doctors in your area and your peer. So now the doctors are shocked. What? I didn't even know I was using that modifier. Guess what? The billing company was adding modifiers. We're changing diagnosis codes. We're upcoding CPT codes. Do a spot check on your billing company. You want to do all this stuff so you could what? Swan. There it is. Sleep well at night. So before we get to questions, let me just go through a couple of other items here. I just want to thank everybody for attending. Here's my contact information. There's my email. You could email me directly, drkotler@targetcoding.com. If you have any other questions and you want to set aside 15 minutes to chat with me, we urge you to do it. I do a lot of these. I probably do about 20 15-minute consultations a week with doctors all over the country, actually all over the world. I have clients in Europe and Australia and other parts of the world. So feel free to set up a free consultation, even if it doesn't have anything to do with today's topic. You just have an issue, maybe you want to become an integrated practice, you just have general questions. You or a staff member, set up a free consultation. Email me or call us and set up a free consult. We're going to get to questions and answers in a couple of minutes. Just want to share with you a couple of things that we do here at Target Coding. We offer training manuals and books and videos. We offer services like on-site trainings and one-on-one consulting. We offer compliance programs on Medicare, HIPAA, and OSHA. We have memberships. We have many doctors that pay us a monthly fee, and we give them updates every month, and we have trainings every month, and you get all of our books and videos, and we do seminars, and of course these webinars. Now we have a compliance program. We call it our Target Coding Chiro Compliance Program, and it's based on the big 3, HIPAA, OIG, and OSHA. And I know many of you get HIPAA headaches. I know many of you have OIG procrastination, and I know many of you have OSHA indigestion. So start working on it. But if you're a busy practice and you just don't have the time to put together a chiropractic compliance program, outsource it. Find someone. If you don't want to use us, that's fine, but find someone to do it. We do it for only $199 a month. This is a limited time offer. $199 a month. Get rid of all your compliance stuff. Send it over to us. We do all the heavy lifting, meaning we give you the manual, we train you on the key parts. If I were to hand you a 100-page HIPAA manual, now what? You want to sit home or have your staff read 100 pages? No way. We'll point out that maybe 10 pages out of the whole manual that apply to your practice, and we'll show you what to do. So we do all the heavy lifting, and we put together nice 3-ring binders, plus you get all the files digitally sent to you so you could update it. And you just have to be with us for 1 year. That's it. After 1 year, you're on your own. This isn't something that you have to do forever, like other consultants sign you up with these 10-year contracts. You don't need to do that with us. Oh yeah, this is the book that has all the code pairing. It also has the codes that pay for long-term, called long-term treatment diagnosis codes. It's all in the book. We have cheat sheets in the book. What else do we do here at Target Code? Oh, we also sell forms. We have a forms packet. Now, forms, you might think, wow, what do we need forms for? Even if you have ChiroTouch, Eclipse, ACOM, you have the best and the biggest, most expensive EHR program, you still need forms. You still need letters of medical necessity. For example, I had a client recently say, Marty, one of my patients needs a letter of medical necessity for a stand-up desk. You ever see those, Vara desks? I said, no problem. I'll put one together for you. Gave it to the client. Client gave it to the patient. Guess what? The insurance company paid for it. Or I think the company reimbursed the employee for it. So we have a whole bunch of letters of medical necessity. We have new patient forms, financial and administrative forms, financial policies, exam forms, a whole bunch of sample SOAP notes, fight back letters. You ever get denied for 97140? Oh, yeah. We have an amazing fight back letter that works, I don't know, probably 85% of the time. Get a whole bunch of Medicare forms, ABN forms already completely filled out. You just have to fill in the blanks. Plus, you get a whole bunch of our HIPAA forms. So you may be interested in our forms. Now, if you just want to check up, we'll review your SOAP notes, 5 charts. We'll help you get proactive to avoid audits. We'll probably help you find money you're leaving on the table. Just adding one CPT code with some of our clients, we've added $10,000 per year by adding one code. So we call it our comprehensive chart audit and fee schedule review. Okay, so we do a whole bunch of other things, but you can contact us for more information. So I just want to make sure that, let's see, yeah, we have time for questions. Let's see what questions have come in, but I just want to make sure that everybody enjoyed today's presentation. If you need to set up a consultation, give us a call at 1-800-270-7044. You could email me directly, Dr. Kotler at targetcoding.com, website targetcoding.com. So I hope everyone learned a lot. And now we're going to get to questions and answers.